Welcome back, everyone, to the Deep Dive. This time, we're going deep into the Absolute Medical Coding Institute's Medical Coding Guidelines MCG manual. We've got a link down in the description if you want to take a look yourself. Today, we're going to be focusing on some of those really confusing situations like adverse effects and poisonings, even suspected abuse cases. It's like we're medical detectives, right? Trying to figure out how to translate these complicated events into codes.
Yeah, absolutely. It's really important in medical coding. And getting it right can affect so many things, from patient care to public health trends even.
Okay, so before we get too far into it, let's make sure we're all on the same page. AMCI has made things easier with this system they call flip and tap. I guess it's all about making those guidelines a little less overwhelming.
Right. So TAP stands for tab, annotate, and place. And it's how AMCI does these nice and clear annotations right in the ICD-10-CM guidelines.
Oh, okay, so they're giving us little cheat codes for coders. I like it. So picture this. A patient shows up with a really weird reaction to some medication. Or maybe there's a possible poisoning.
Yeah.
How do we, as coders, capture that in the coding system?
It's all about being precise and very thorough. Luckily, ICD-10-CM has some cool tools to help with this. One of them is these things called combination codes. You can think of them like little packs of information. In the T36, T65 code range, each of these codes tells us three things: what the substance was, what happened, and if it was on purpose or by accident. The intent, basically.
So one code tells a whole story, huh? So does that mean we don't need any other codes for those events?
Yep, exactly. If you use a combination code, you don't need extra codes for poisoning or toxic effects or adverse effects, and even for underdosing.
Wow, pretty efficient. Now, we have that table of drugs and chemicals to help us find the right codes, but I've heard you can't just code directly from there.
You're right. That table of drugs and chemicals is a great starting point, but you always have to cross-reference the code you find there with the tabular list. It's like double-checking a recipe, before you actually start cooking.
Yeah, that's a great analogy. You don't want to end up with a coding souffle that's a total flop.
Exactly. And speaking of doing things right, there's a rule that says to use as many codes as you need. I know it sounds scary at first, but it really just means we got to be careful and thorough. If a patient has reactions to, say, more than one medication, we have to code each drug separately.
So we're putting together a puzzle. We have to make sure we've got all the pieces to get the whole picture right. But what happens when it's the same drug that causes multiple reactions?
That's where that code it once rule comes in. If you have a single code that describes the whole thing, you only use it once. No need to repeat.
Makes sense. So we're being efficient without sacrificing accuracy. Okay, let's jump into those different scenarios, starting with adverse effects. What exactly does that mean for coding?
An adverse effect is when someone has a reaction to a drug that was actually prescribed correctly and administered right. It's like an unexpected bad response,
So right drug, wrong reaction kind of thing.
Exactly. The way we code for this is to use the code for whatever that specific effect is, like if it's tachycardia or hepatitis. And then a code from the T36, T50 range to show which drug it was, with a 5 at the end to tell us it's an adverse effect.
So it's like we're pairing the specific effect code with the drug code and making sure it's marked as an adverse effect.
Got it.
Okay, now on to poisoning. What are the big things we need to remember when coding for a poisoning?
The intent is super important. We need to know if the poisoning was accidental, intentional, like self-harm, or maybe an assault, or even if it's just unknown. This gives us the whole story.
So if someone takes the wrong medication by mistake, that would be like accidental poisoning. But what about when we just don't know why it happened?
When we truly don't know, we code it as accidental, unless, of course, it's specifically documented as undetermined.
So we're like detectives with these codes, huh? Trying to piece it all together. Okay, what about underdosing? It sounds less dramatic, but what exactly are we talking about here?
Underdosing means a patient is taking less of their medication than they're supposed to. Or maybe they stopped taking it without talking to their doctor.
So not just like forgetting a dose once in a while, but like a pattern of not taking enough, right? Yeah. What do we need to remember when coding for this?
We use those same T36, T50 codes, but with a 6 this time to show it's underdosing. We might also need extra codes if they weren't taking it on purpose or if the underdosing caused other problems.
It sounds like it can get pretty complicated depending on what happened.
Yeah, it can. And one really important thing is you never use an underdosing code as the main diagnosis. The main code is for what happened because of the underdosing.
But so it's about cause and effect. Underdosing leads to something else, and that something else is what gets the main code. Okay, so we've talked about medications. What about those other toxic effects, like from household chemicals or things like that?
Those toxic effects, we code them kind of like poisoning. We use codes from T51, T65 to be specific about the effect. We list everything it caused, and then we look at the intent behind the exposure.
So whether it's a kid getting into the cleaning supplies or a worker exposed to dangerous stuff, we're looking at the substance, the effects, and the intent. Okay, now for something a little sensitive but important. Abuse, neglect, and things like that. How do we code those accurately and sensitively, of course?
First, we got to figure out if the abuse is confirmed or if we just suspect it. If it's confirmed, we use codes from the T74 range. But if it's suspected, we use codes from T76. And these codes would be the main ones in these cases.
So we're being clear about what's verified and what's still being looked into. What else do we need to capture in these situations?
Well, we need to document any mental health conditions, if there were any physical injuries, and what caused them. We'd use codes from the assault section, X92 to Y09 for that, and if we know who did it, we'd use a perpetrator code from the Y07 range.
So it's not just about the abuse itself, but the bigger picture, like the mental and physical effects, right?
Yeah.
What about when abuse is suspected, but then ruled out? What happens then?
In that case, we don't use the T76 codes. We would use specific Z04 codes to show that abuse was considered but ruled out. It's all about being super precise and using the codes that actually match what happened.
It's amazing how these codes can really cover those sensitive situations. Before we wrap up this section, what about those long-term effects, the late effects, like the things that happen weeks, months, or even years after the poisoning or adverse effect or exposure? How do we code those?
Yeah, those are called sequelae. They can be tough to code because you have to show a clear cause and effect relationship. Section IB10 in the guidelines has all the rules for coding these long-term consequences.
So we're back to being detectives, connecting those dots between past events and present conditions. Wow, we've talked about so much already. From those combo codes and adverse effects to poisonings and even abuse cases. Is there anything specific that seems to trip coders up when it comes to these guidelines?
You know, one thing I see a lot is problems with insulin pumps. If there's a poisoning because of a malfunctioning insulin pump, there's a whole specific section in the guidelines for that, section IC4. It's a good reminder that sometimes you have to look a little deeper in those guidelines, you know, for those tricky cases.
Oh, good point. So it's like we have a secret decoder ring for those tough situations.
Yeah.
Before we move on, I wanted to touch on abuse during pregnancy. Are there any specific guidelines for those cases?
Definitely. Abuse during pregnancy is a serious issue, and it can have really bad consequences. Section IC15 in the guidelines is all about this. It's a whole section dedicated to this complex situation. So, you know, it's really important to know those specific guidelines when you're coding these sensitive cases.
It's all about having the right tools, right?
Okay.
And making sure we're approaching every situation with the right level of detail and attention. Okay, before we move on, let's go back to those combination codes for a second. They seem super helpful, but are there any things coders should watch out for? Any common mistakes?
Yeah, that's a good point. They are really useful, but there are a few things to keep in mind.
Okay, so what are some of those potential pitfalls with combination codes?
I think one common mistake is assuming a combination code always tells the whole story. They're meant to be really complete, but sometimes you might need extra codes to really capture everything that's going on in a case.
It's like thinking one photo can tell the whole story, right? Sometimes you need a bunch of different perspectives to get the full picture.
Exactly. And another trap is using a combination code when there's a more specific code you could be using. The whole point is to be as accurate as possible. So if there's a code that's even more precise, that's the one to go with.
So we're choosing the best code to get that exact detail right.
Yes. And never forget to cross-reference that combination code with the tabular list, just to be sure it matches up with the details of what happened.
So it's all about being careful and double-checking, making sure everything lines up. With that in mind, let's move on to some final thoughts on this really fascinating topic.
It really is like detective work, right? We gather all those clues and put the story together, and then we use the right codes to tell that story, you know, in a way that makes sense to everyone.
It is. And speaking of stories, some of those stories really stick around. You know, we've talked a bit about late effects, the sequelae, but I think it's worth spending a little more time on those. What makes these late effects so important for us coders to really get?
So late effects are those long-term problems that can pop up weeks, months, sometimes even years after whatever caused them. Like they're echoes of what happened before.
So it's not just about coding what's happening right now, but also understanding how the past can still be affecting a patient. Why is it so important for coders to know about these late effects?
Well, one big reason is that if we document those late effects really well, it gives doctors a much clearer picture of the patient's whole medical history. It's like filling in those missing pieces of their story, and that can help the doctor make better decisions about their care.
Yeah, that makes sense. It's all about giving them that context, showing how something that happened in the past might still be affecting them now.
Right, and it's not just about individual patients either. When we document these late effects, it actually gives us data for public health research. It helps us see patterns and trends, and hopefully that means we can eventually stop these things from happening in the first
Oh,
place.
so we're really contributing to something bigger, huh?
Yeah.
Using those codes to tell a story that goes way beyond one person's experience.
Exactly. Now, I know coding for late effects can be tricky sometimes. You have to show that direct link between the cause and the effect. And that often means really digging deep into the patient's records.
So we're putting on our detective hats again, looking for those connections, right?
Yep. And to help us navigate this whole world of late effects, we have section IB10 of the ICD-10-CM guidelines. That section gives us all the instructions we need, like how to pick the right codes, how to put them in the right order, and how to add those extra details to really get the complete picture.
Okay, so we've got our trusty guidelines. But can you give us an example of what these late effects might actually look like in real life?
Sure, let's say someone was exposed to something toxic a long time ago, maybe even years, and now they're having problems with their memory or they can't concentrate as well. Those problems could actually be a late effect from that exposure.
So we're not just coding for the memory problems, but connecting them back to that exposure from way back when.
Exactly. Or let's say a patient had a really bad reaction to a medication a while ago. Now they're having trouble breathing or they have this cough that won't go away. Those breathing problems could be a late effect from that medication reaction.
It's crazy how something can have those lasting effects.
Mhm.
Really shows how important it is to think about more than just what's happening right now.
And late effects can show up in all sorts of ways. You might see heart problems, mental health problems, even problems with their muscles and bones. And they could all be coming from something that happened a long time ago.
Wow, that adds a whole other level to things.
It does, and that's why it's so important for coders to stay updated, keep learning, and to talk to doctors and nurses to make sure they're getting those lead effects right.
It sounds like there's always something new to learn in this field, which makes it both challenging and really interesting.
Absolutely. There's always something new to figure out, some new connection to find, and that's what keeps it exciting, you know?
I agree. Okay, so as we wrap up this deep dive into adverse effects, poisonings, and those super important late effects, what are the big takeaways for our listeners?
I think the biggest one is that getting it right really matters. Every code we choose is telling a story. And it's our job to make sure those stories are complete and accurate, because in the end, it all comes down to giving patients the best care possible.
That's a great way to put it. It's not just about going through the motions with these codes. It's about understanding that they really can make a difference for patients, for public health, and for healthcare in general.
Couldn't have said it better. And that brings us back to the question we asked earlier. How can we, as coders, use what we know to make sure patients are getting the best care?
It can be hard to see that bigger picture when we're busy with all those codes every day, but it's also really powerful when we do.
I agree. When we really understand these guidelines, we can make sure that those patient records tell their whole story. And that can lead to better decisions about their treatment and hopefully better outcomes for them, too.
It's like we're giving those patients a voice, making sure their experiences are heard and understood.
Exactly. And as we wrap up this deep dive, I want everyone to remember, never stop learning. The world of coding is always changing, so be curious, keep learning, and always be looking for those moments that help you understand things even better.
Wow, we've really gone deep today. From those handy combination codes to the complexities of late effects, it's really clear these codes aren't just like random numbers and letters. They're tools, tools that can have a real impact for patients, public health, even research.
You know what I find really cool? It's how these codes can help us understand the bigger picture, like trends and patterns. When we code accurately, when we get it right, we're actually adding to a huge collection of knowledge. And that knowledge can inform all sorts of things, like making medications safer or even those big public health initiatives.
It's like we're all working together to improve things, one code at a time, huh?
Yeah, exactly. And that brings us back to that question we asked before. How can we, as coders, actually use what we know to advocate for better patient care?
It is a challenge, right? To see beyond the day-to-day coding and think about the bigger picture. But when we do, It's pretty amazing.
Absolutely. When we understand all the little details of these guidelines, we can make sure the patient's story is being told correctly in their records. And that can lead to better decisions about their treatment and hopefully even better outcomes for them.
It's like we're giving them a voice, right?
Yeah.
Making sure their experiences are understood.
Exactly. And as we wrap up this deep dive, I want to leave everyone with this thought. Never stop learning. The world of coding is always changing. There's always something new. So stay curious, keep learning, and always be looking for those aha moments, the ones that really make things click.
Couldn't have said it better. To all our listeners, thank you so much for joining us on this exploration of ICD-10-CM coding. I hope you learned something new and that you feel inspired to keep digging deeper. Until next time, keep those coding brains working, and we'll see you on our next deep dive.